Good afternoon, everyone. I want to thank you all for joining us for this really important discussion about suicide prevention and the agricultural community. My name is David Brown. I'm the Behavioral Health State Specialist for Iowa State University Extension Outreach. And I'm going to go ahead and ask our other presenters to go ahead and introduce themselves as well.
Good afternoon. My name is Dawn Dunnigan. I'm a human sciences specialist in the area of family well-being, and I serve 12 counties in Southeast Iowa. And I'm thankful to have you here today.
Hello all, I am Danielle Day. I'm a human sciences specialist in the area of family well-being, and I serve 11 counties in East Central Iowa.
Hi everyone, I am Demi Johnson, and I'm our behavioral health program coordinator for across the state.
Thank you, all of you, for being with us today, and thank you for the presenters as well. Let me just start to talk a little bit about why this is such an important topic. We know that studies have indicated that agriculture producers are at a high risk for suicide and have a higher occurrence of depression and anxiety when compared to the general population. We also know that the COVID pandemic didn't necessarily improve those conditions as well. So ISU Extension Outreach has therefore made addressing this issue an important part of our programming and program efforts. And so for the next few slides, we're going to review some of the following objectives.
So really our objectives for today we're going to take a look at that first initial program and our first interactions with our agricultural community here in Iowa. And then we're going to look more specifically at two programs, Question, Persuade, Refer, and Mental Health First Aid that we really focused on providing throughout the past few years. And then we're going to look at those outputs, those outcomes, and kind of how we have continued to expand and grow since these first initial projects. So little history. With the uncertainty in 2019 with ag markets, weather, everything that was going on, we were really aware that the mental health in our ag communities needed to be addressed. And so we met ag producers where they were going to be. We really focused on those farm bill meetings. And so we offered a 40-minute presentation that was locally developed by Dr. Brown at farm bill meetings in 2019 and 2020. And this really engaged in the ag community and suicide prevention. We included information about warning signs of suicide, those risk and protective factors, and then we had some scenario-based group work that we did that utilized the CORN model that was developed by Dr. David Brown, and we're going to share that model with you here in a few slides. And all of this was funded by Great Plains Center for Agricultural Health. So a little background on these Stress on the Farm programming that was offered at these farm bill meetings. We actually offered 95 in-person meetings. And of course, this was pre-pandemic in the fall of 2019 and kind of early winter of 2020. This was a collaborative effort between our human sciences specialists in the area of family life, our agricultural and natural resources specialists in the area of farm management. And then we partnered with Farm Service Agency and the counties, the county directors to market the program and ensure individuals would show up. And we actually had 4,376 participants at these 95 in-person meetings. Now I'm going to share with you the CORN model that was created by Dr. David Brown. And this really, it was developed to assist participants to engage and intervene with those that they may be concerned about, but maybe weren't sure how to engage previously before the program. So first, the C stands for choose to engage, which is one of the most important steps, because if we don't engage, we can't help our community members. Then we offer support. We listen and respectfully ask, are you thinking about killing yourself? And then we refer the person to either helplines or lifelines or local resources. And you can see the card on the side of the screen that outlines each one of these steps. This card is actually kind of a 3x2 card that people can keep in their wallet. And on the back actually lists some of those resources that we can refer them to so that it's always with us. And the final step, we never leave the person without alone or without a plan, and we never leave them without hope. This model was developed, obviously, utilizing corn because we knew farmers can remember corn. I'm going to turn it over to Dawn to share about our next program.
Excellent. Thank you, Danielle. Question, persuade, refer, which we'll call QPR. Ask a question, save a life. So what we did first, through Farm Bill meeting presentations that Danielle shared with you, the responses across Iowa, plus predictions of a rise in suicide deaths due to the pandemic, Dr. Brown identified the need for a suicide prevention program that could be used regionally. He found funding with the USDA NIFA. He, Danielle, and I were all trained by January of 2020 and began preparing for face-to-face programming. The pandemic hit, and we immediately began a transition for virtual trainings and offerings. Our first online training was ready for rollout by April 6th of 2020. Programs were addressed for targeted audiences, such as youth, adults, agricultural, first responders, higher education, and faith-based communities. By August 31st, 2020, we had provided 35 trainings certifying 539 individuals in QPR, and we feel saved lives. Question, persuade, refer is a 1-hour nationally recognized evidence-based program on suicide prevention. It includes information on suicide clues and risk factors, and the 3 process steps, question, persuade, and refer, to engage individuals who are at risk. And again, we couldn't have done this without the funding from USDA. Our overall outputs were 762 participants, attended 78 programs between April 2020 and August of 2021. We had participants from 16 states and territories in Canada. Participants represented USDA groups, commodity groups, farm credit, banks, state departments, agricultural, individuals from public health, cooperatives, veterinary medicine, health and human services areas, and other helpers in the community. Again, why? There were predictions that there might be a spike in death by suicide due to social isolation and the economic impact of the pandemic. The agricultural community was also impacted. So our goal was to increase participants' knowledge of how to ask the suicide question, how to persuade an individual to get help, and how to actually find help to refer an individual at risk to services. We felt we were successful since 70.73% of participants who completed evaluations rated their knowledge of how to ask about suicide as high, compared to 13.84% on the pretest. We also noted that 54.7% rated their individual as on how to persuade an individual to get help as high. And that might not sound like a lot, but compared to the pretest of just 11.78%, that was a significant increase. We also found that nearly 71% of individuals rated their knowledge of how to get help for someone as high compared to just under 20% in their pretest evaluation. So where are we now? The program has continued to expand. Demi Johnson was hired as a program coordinator to help keep us all on track and in line. We've hired 2 Spanish-speaking facilitators, and programs are now being scheduled in collaboration with organizations that specifically train agricultural workers and their families. New marketing materials were developed and have been widely disseminated. And additionally, 9 facilitators have been trained so that programs can be held in person, any place in Iowa. There have been some wonderful marketing pieces and images that have been created by our creative project director that we have been using on social media and in our print pieces to help promote and make people aware of QPR, question, persuade, refer. I'll turn it over to Demi to share with you a little bit about our mental health first aid initiatives.
Thanks, Dawn. So this slide just shows another one of those design pieces that our team put together that we will either include on our social media images or play kind of on scrolls before and after other programs that Extension and Outreach offers. But now we'll get to talk a little bit about what mental health first aid is. So mental health first aid is an 8-hour internationally recognized and evidence-based program that teaches participants how to identify, understand, and respond to signs of mental illness or substance use disorders in adults or in youth if they're taking the youth mental health first aid curriculum. Like our other programs, we've been able to offer this for free to our AG audience through funding through the USDA and NIFA, which was received in around 2019. So we came about this because Dr. Brown identified a need for our staff and community members to have a training in mental health literacy and how to intervene during a mental health challenge or crisis. Soon, Dr. David Brown and Dr. Anthony Santiago, who is also a licensed mental health provider, were our first 2 trained instructors in 2018. Later that year, Iowa State University Extension and Outreach staff were our first participants in the programs. Through 2019 and 2020, we added 2 agricultural and natural resource staff as trained instructors, as well as adding in our hotline manager as a trained instructor. In the first 2 years, 12 in-person trainings were offered to 237 participants. And about this time, our first year of the USDA NIFA funding was secured, and that's also about the time the pandemic hit. The USDA NIFA funds allowed us to focus on training our egg-based audience. So, like we've said, because egg producers are at a high risk for suicide and had a higher prevalence of mental health disorders, our goal was to increase participant knowledge, especially for those who work with and advocate for individuals involved in farming, on how to respond to those individuals experiencing a mental health or substance use challenge or crisis. And we felt that we were successful since 89% of participants who completed evaluations for our virtual courses strongly agreed that they were confident in asking someone whether they were considering killing themselves, as compared to only 48% during the pretest. Similarly, 94% of participants strongly agreed that they were confident in having that supportive conversation with anyone about mental health or substance use challenges, as compared to only 51% at the pretest. And finally, 83% of participants strongly agreed that they were confident responding to a substance use crisis, including an overdose, compared to only 15% at the pretest. So next, Dr. David Brown is going to talk about what we are doing now and where we are going with these programs. Dr. Brown, you are muted.
Yeah, as Amy noted, we have greatly expanded the mental health first aid program. New marketing materials were developed. Demi was hired as our program coordinator. Between August 20 and August 21, we had 25 youth and adult virtual mental health first aid courses completed. An additional 341 participants were trained. Again, our in-person and virtual classes and continue. Now, what's really important is we have also trained, thanks to NIFA USDA funding, and additional regional facilitators are being trained or in the process of being trained, primarily in the thought that we'd be moving our programming in more of a in-person program. But again, we feel that lives continue to be saved. And again, here's some of our other social media identifiers related to mental health first aid. We have a variety of them, not only ag related, youth related, but we also have others more generally related to individuals who may be interested in taking and participating in a mental health first aid course, and they have been used very widely. And I need to say, we have greatly expanded all of our QPR efforts across the state. We went from 3 QPR instructors initially to now we have 12 QPR trained instructors, or soon to be trained, that are located across the state to more easily serve all Iowans as we become more open to in-person programming. We've also expanded our reach beyond offering programs just to agribusiness, the youth professionals, or first responders. We've also provided or will be providing programming to faith communities and to Spanish-speaking audiences. Again, mental health first aid efforts have greatly expanded from an initial 5 facilitators who only offered in-person adult mental health first aid to eventually 16 facilitators all around the state, with most having the capability to provide adult and youth mental health first aid programming virtually or in person. And that's a greatly increased capacity to offer this program anywhere in the state of Iowa to multiple different types of audiences. So what we're going to do now, and I guess I'd like people to go to the chat box a little bit, and we're going to open up this question because this is in my work and in my collaborations, this has become a question that's been addressed through the extension system. And that is, why is suicide prevention education a good fit for cooperative extension? Or maybe those of you may say, well, why is it not a good fit? But I guess I want to open that up. Or if you want to even open your microphone, that would be fine as well. We just want to have a little chat here and discussion about that.
I think extension has a unique capacity because we are across states. Not all organizations are, cover a full territory. They might cover like these 9 counties or these 10. And so I think we're unique in that extension is statewide in most states.
Now, we've also found if we're targeting agriculture audience, one of the biggest aspects of extension, obviously, is our connection with the agricultural population through our agriculture extension colleagues. And so it provides a natural partnership to provide these programs to that community.
Some of the comments coming in the chat are wonderful. Extension does all other types of prevention education work in the public health sphere. And Extension staff are trusted professionals. We interact with rural audiences. We know how to meet people where they are. We're research-based. One of the most pressing issues of our time. So that's what we do.
Yeah, and so when you talk about that, it is such a pressing issue. Sometimes people get a little scared to to address that, certainly in a public forum. But obviously we found a lot of success. We have a lot of success stories that came in, not only anecdotal, but obviously through our evaluations of how an extension service can impact such an important issue in the communities and across the states.
I'll add it. We recently learned that some of our staff who are trained in non-typical mental health programming, but maybe it's like some of the youth programming or family programming, were being asked and told stories about mental health. And so having the training in QPR and mental health first aid has provided them with a basis for understanding and knowing and feeling more comfortable with the ways to respond to some of the stories that community members and youth were telling them.
There's a question out there: are farmers attending the mental health first aid training? I'm going to say my guess is some farmers have been attending the mental health first aid training. We're really trying to target mental health first aid to those who are advocates for the farmers, for example, agribusinesses, banks, veterinarians. Those are interacting with farmers, because we know it may be a little tough sell to have farmers attend, but we want that community that are supporting the farmers to be the ones attending, because they're going to be able to signs and symptoms and can help refer the farmers or family members to the appropriate resources. And we have had some success in getting the agribusinesses to attend mental health first aid. Now, one of the other things you might want to think about, we've had some really key successes, is when we combine programming on stress management and suicide prevention with other ongoing agriculture-related programming. That's when we've had a lot of success interacting with farmers and those involved in agriculture. When they're there for another program that they're interested in, and then we add on a mental health first aid program, or add on a suicide prevention program to that. That's where we've had our biggest success in accessing farmers.
It's also important to kind of note on those that we have trained, since we have so many regional people trained in mental health first aid or question, persuade, refer. We have people trained across all sectors of extension. So we have youth professionals, we have those in agricultural and natural resources. So it's sometimes easier to have those that are the trusted individual for and have that connection with the population. They're able to get that particular population to attend the programming. We do have another, oh, Demi, you answered it, never mind.
One thing I may add is that we have all of our programs are listed on our websites, which also includes all the registration sites and registration information. So anyone across the nation or across the state can go to our websites and register for any of our programs, especially if they're done virtually. So we found it a really nice way to market and offer our programs to be very accessible to anyone who's interested in participating in one of our classes.
I had a question. I'm from Penn State University, and we are doing a similar project too with mental health first aid. And I'm just curious, are you marketing to farmers directly? Are you marketing to the ag industry professionals? How are you reaching the farming community? I think that's what we struggle with. Currently, we're offering mental health first aid across our state. And the majority of the folks that we have are probably more in social services than in the ag community. So our team has decided to branch off and actually have a farm stress team. That's what we call ourselves. And then we offer the modules that Michigan State University has developed. So we feel that that's something that's that is more practical, I guess, for the ag community, because they're only an hour or 2 hours. You can create something for an hour or 2 hours, when the mental health first aid is an 8-hour program. So I'm just curious, like how are you marketing to your ag group? And I think we are marketing the mental health first aid to our ag community too, but haven't had as much interest because of the length of time.
I think that's an excellent question. I think we have been primarily marketing the mental health first aid classes to the agribusinesses. We are going to be starting a project. We're actually in the process of starting a project that will be able to get this information out to the farmers directly through the agribusinesses and those advocates. So we are going to be a little bit more creative in our marketing as far as handing out lots of handouts and information and farm stress packets to our businesses that they can hand out to their clientele. So we're hoping to use that means of marketing to get more farmers attending our mental health first aid programs.
And did you find that when you're doing the marketing to those ag industry professionals, are you using the context that you already have, or are you creating kind of a consortium to bring them together in an effort to be able to do this, or how are you reaching that group?
Well, quite frankly, we have a lot of different key mailing lists for individuals and email addresses. And so many times I'll do a direct email to the key leadership and agribusinesses all across Iowa. And that has been fairly successful. Again, we do news releases. All of our marketing materials are directing toward much of our marketing material is directed to the ag community. So we have a number of our ag and natural resources specialists or marketing as part of their just any general agriculture programming across Iowa. So we have a lot of different means to get that information out. So we're relying also on our agriculture natural resources specialists as well.
Okay, thank you. That was helpful.
So the question is, so are you saying that emphasis on farmers is predominant? Why predominantly farmers? Or do you extend it to other organizations, other professionals?
I apologize. I didn't understand the question. Could someone maybe else address that from our
Oh,
team?
no. Once the question is that why mainly farmers that the program is geared towards mainly? Why not other areas as well?
Okay.
So I think, whoops. Predominantly the farming population was chosen partly because of funding, but partly because we also knew that the farming community has been hit hard over the past several years with the change in pricing, weather, tariffs, all of that. And so our target audience really became the farming community because that impacts so much of our rural communities. And so if we focus on their mental health and educating the community around our farmers to be more supportive, then we are able to kind of open that door and reach more people that wouldn't necessarily. We know human service agencies are going to reach out for mental health programming, but not necessarily our rural population, and it's not necessarily offered in that location.
Also,
Okay.
if I could just add there, Joseph, thank you for the question, that we know that our farmers work in isolation. They often don't have a lot of people tapping into their mental health or how are you doing? We also know that often men and rural men don't attend to their physical health, and so their mental health even becomes secondary to that. So because of the isolation, because of the lack of resources, because of the lack of mental health education, and of course, as Danielle shared, the funding, those are some of the other reasons why we want to capture this audience. And of course, we are bleeding into other sectors, and that's a positive thing.
Thank you. Thank you.
Now, one of the other benefits to mental health first aid programming is that you can also go into different specializations based on things that they offer. And we will probably be looking at that next year to make the program more amenable to other populations who could also benefit from it as well.
Second question, do you how much does it cost for the training?
Very good question. If you're anyone who is involved in agriculture or who is an advocate for agriculture, or for example, agribusinesses, a farmer, things like that, veterinarian, or even a youth professional that is supporting maybe foreign children, things like that, that price is at no cost due to grant funding. Now, we do have other private classes that we get requests for. And for those classes, we're now charging $75 a person for 15 people who are attending.
Thank you.
It is a little after 12:45, so we do want to honor everyone's time and let them go get some self-care if they need it before the next session, but we will stay on for a little bit here if anyone has additional questions.
Will the PowerPoint be available that we can view those slides, particularly like the marketing slides? So we have a little bit of an example that we could share with our marketing.
We actually typically don't share our slides, but if you want to can contact with me directly, I do have some other information and other handouts I would be glad to share.
Oh, that would be wonderful. Thank you.
And I'll put my email address in the chat box.
Okay.